Welcome back to my channel. Today's video is going to be an overview on autism spectrum disorder, also abbreviated as ASD. And typically we can call people with autism either autistic people or a person with autism, but based on my research and watching many different interviews of autistic people, people prefer identity first language and like to be called autistic people or an autistic person rather than a person with autism. So that's just a little throw in there. I'm going to start over here with what is ASD, and I'm sure many of you know the basics. Autism is a developmental disorder, also neurobehavioral disorder, and there is no single reason or cause to why someone develops ASD, and there also is no cure. This is a lifelong disorder, and we help as OTs and other therapists and practitioners help to support people with autism to be able to live a normal life, and we're going to help them access their activities of daily living, so we'll get to that. But as you guys know, OT cannot diagnose, so we can refer out if we feel like we're working with a child who has signs of autism. Then you can have that conversation with mom and dad when you feel that they are ready to refer out and get that diagnosis if that's something that they are ready and open to. But of course, we continue to treat and support children with ASD. Typically, children with ASD are not diagnosed until after the age of 18 months. Sometimes I have seen cases where it's earlier than that, but typically it's after 18 months. ASD also oftentimes coexists with other impairments and disabilities. We have epilepsy, ADHD, OCD, dyspraxia, visual impairments, dyslexia, and hyperlexia. I feel like a lot of these are fairly kind of common knowledge, at least what the terms, what they mean. But just quickly, dyspraxia is when you have difficulty with motor learning. So learning new patterns of movements that are novel are hard. And dyslexia, of course, is when you have difficulty reading words and letters. But hyperlexia is when you just kind of have this fixation over numbers and letters, which several of my kids who I work with have had. So I've had kids I had one kid who I'm thinking of, such a sweet boy. He would always get fixated on the alphabet puzzle, and that was the only thing that was motivating. So we always had to kind of somehow integrate the alphabet puzzle to get him to work towards his goals. It was pretty funny, actually. But yes, that's hyperlexia. And there are like two key defining characteristics for autism. One is a communication speech delay. So oftentimes children with autism have poor eye contact. They have difficulty holding a conversation or sustaining their attention in like a social setting. And also the other one is like repetitive play fixations towards objects, toys. They'll play with something like in the same way or do something repetitively. So there's a lack of spontaneous play there. And I added just a little extra. Usually sensory processing, motor planning, and executive functioning areas are difficulties also. So moving on, we're going to talk about what can OTs do, and we've already kind of started touching upon that, but obviously we can evaluate a child to see what their needs are, and we can develop a treatment plan whether they are diagnosed with autism or not. So typically, like within an OT clinic, we are really big on developing sensory diets. So most of my kids have sensory diets, and what I like to do is to wait a few sessions after I evaluate to get to know the child, to interview the parents, see where the child's preferences and needs are, and then I'll collaborate with the parents to develop strategies to carry over at home, and that's going to help support their activities of daily living, their sensory integration needs, and anything else that I see and note. But typically you don't develop a sensory diet unless you have done sensory testing of some sort, which we will talk about over here. So that's that. A lot of people think diet and think it's food related, but really it's just a sensory plan or a home program. So OTs are going to see kids with autism either in a clinic setting or in a school setting. So what I did was I sort of broke those two apart because they are very different settings. So in a clinic, we have a gym and we can address sensory integration, we can address activities of daily living, but we also can do like the gross motor, fine motor, attention, executive functioning, the whole gambit. In school, however, it is more education based. So it's more common for school OTs to be addressing fine motor skills like writing and grasp, scissor skills, as well as the attention that goes with it to stay engaged at a table, to participate in school. So that's how school OT would work. And this is just a note that goals between the clinic and the school should not overlap. So whenever we have children who have an IEP, which we're just about to talk about, an individual education program or plan that the school provides, that means that children with IEP get services at school. So they can get OT at school, speech at school. Whatever goals the IEP has for the OT, you cannot use those goals in the clinic. They should not overlap. So that's something that we always have to keep an eye out and keep track of so that basically we don't get in trouble with insurance. But yes, as long as your clinic goals are focusing on more of the self-care goals, that's what insurance likes to see. Okay, so school setting. So we just touched on this. An IEP is an individual education program, and this is something that children with disability are eligible for. It's free and appropriate education through the IDEA, which is the Individuals with Disabilities Act. And so IEPs have like regular interdisciplinary team meetings. Usually they meet once a year with the family or the parent, and they go over like what goals they're gonna make and if they're measurable, and they really involve the family into developing the intervention plan because everyone needs to agree on it in order for the deal to be sealed. So that's just kind of a quick overall overview on IEPs, but you also have to think about when kids get older. So once kids are 16, the goals and the things that are addressed in the IEP become a little bit more about transitional services. And I made a note on that because I feel like a lot of older people with autism kind of get overlooked. So transitional services could be more like post-secondary life goals or plans. So what does a child plan to do after? Will they be needing independent living skills, or are they going to need support going to college or whatever it is? So that's more of those transitional services that kick in as the child gets older. And we are almost done. So now we are on the evaluations and tests. And believe me, there are so many different evaluations and tests that I may have not even heard of. So what I'm doing is covering just a basic overview on some that I have heard of and some that I like to use. Generally speaking, it is a given if a child has autism that you are going to do some kind of sensory testing. There are different kinds. I think the main ones are the sensory profile and the sensory processing measure. And the sensory profile has two different breakdowns for children and adolescent adult, which is nice. My preference and favorite is the sensory processing measure, and it has like a home form as well as a school form, and it is a questionnaire that the teacher or the parent can fill out, and it's very easy to score, and it's broken down into different categories like social participation, auditory hearing sensitivity, visual sensitivities. So it's a really nice breakdown. And there's one for preschool, and there's also one that's for a little bit older kids. So I love the SPM. That is my go-to. There's also, backtracking, a short sensory profile. It is not standardized, but the speech therapists at my clinic like to use it because it's just a really quick and easy overview to kind of get an understanding of where the child is at. So there are a lot of different resources, but my favorite is the SPM. I have a little bit of a bias there. Okay, so no matter what, you always want to do a parent interview or a patient interview if the patient is old enough. And it's going to help you really determine their interests, their needs, and of course their goals. So that's very important. And I listed a few different tests that I learned about and have come across. I love this coping inventory. I haven't used it before because I haven't worked with children with autism that are 15 and older, but this is a great one because the idea behind it is just so important that older kids, you need to assess their habits and their coping skills and their behaviors to cope. They're at a very different time period in their life, and they're about to do that transition into high school. There's just a lot more, I feel like, peer pressure and socialization aspects involved. So this sounds wonderful. I haven't seen it before, but I think it's a great one, especially for high school transitions. And then there's a school function assessment, as I tend to just say SFA. I don't know if that's an actual abbreviation, but I like to say it that way. It monitors functional performance. Functional, so not academic. It's looking at functional performance for school participation to find areas of need. So this is nice because you can see if participation is an area of need, first of all, and in what ways, and this can help to increase that participation at school. All right, bear with me, guys. We are on our last two. So let's move on to the Childhood Autism Rating Scale, which is also called a CARS. And this is great. Think of rating because it is a diagnostic tool, and it can help distinguish between a typically developing child and a child who may have autism, and also the severity of that autism starting from 2 years and up. So there are like different forms to it, but it's nice because it's a parent report and you can get information from them as well, or you can do observations with the child and see where they would fall, and you rate those scores and you can score it. So if you have a child that you're working with who doesn't have an autism diagnosis, you could do this with them, and it could be part of your initial evaluation or reevaluation, and that can be given to the parents if they down the line want to take it to like a developmental pediatrician to get the diagnosis. So there's that. And the last one, I wasn't sure if I wanted to include this, but I thought I might as well. It's the Social Interaction Scale of Bay Area Functional Performance Evaluation. That is a mouthful to say. I think there are a lot of specific assessments that have been developed and created within California, and maybe because I went to school in California, this is something that I learned about, but I wanted to include it anyway. I thought it was a pretty cool assessment. Just to be quick, so the Social Interaction Scale is looking at exactly what it says. It's looking at how a child interacts with their environment, which I think is super important for a child with autism. And they observe them in 5 different situations, which I like. There is like a optional self-report option, and it's great for kids who are like school age. So I think this is a wonderful evaluative testing tool. And that is the end of the video. So thanks for watching, and I hope that this kind of was a helpful overview and review for autism spectrum disorder. If you are studying and you have been studying for a long time today, please take a break and remind yourself that you are doing great and you know way more than you think you know, believe me. And go get some sunshine. That is so important. So take care, and I will see you guys in the next video.